Hi, you guys. Welcome back for our daily practice questions. It is day 257. And as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and houses all of the resources that I offer. And as always, I also like to direct you to my business profile by simply going to Google and searching The Nursing Studio. It will bring you here where you can find my contact phone number, the link to my website, and reviews from previous review students. All right, you guys, let's get into the questions. Question number one states, a 47-year-old woman with hypertension and type 2 diabetes has an LDL of 165 milligrams per deciliter. According to current guidelines, what is the best next step in management? Is it A, initiate moderate intensity statin therapy? Is it B, initiate high intensity statin therapy? Is it C, lifestyle modifications only? Or is it D, recheck lipids in 6 months before treatment? Take a moment and tell me what you got in the comments, y'all. All right. I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, according to current guidelines, what is the best next step in management? All right, so this is a treatment question. And you know what I always tell you, if they're looking for a treatment, you got to run it back and see if they provided you with a diagnosis. And if they have not, run it back and look at the assessment findings so you can determine what it is, right? Because we got to know what it is to be able to treat it. So no diagnosis is provided, but a lot of context is. So we have a 47-year-old woman. She has a history of hypertension and type 2 diabetes, but her LDL is elevated at 165 on exam, right? So here's two things you need to realize. One, we need to know what is the goal of the LDL. So typically, we want our LDL to be less than 100, right? But remember, if it's somebody with comorbidities, um, including this age group with comorbidities such as hypertension and diabetes, we actually want it less than 70 because your risk factors are already high. Your ASCVD score is elevated. So we want to knock this LDL down, right? And get it into a goal range. So now when we consider what type of intensity statin, remember on the percentage of reduction that the medications can give. So high intensity statin, your best answer would be B, to initiate a high intensity statin, simply because remember, high intensity statins cut the LDL by at least 50%. We're at 165. We need this cut by at least 50% to get them less than 70, right? All right, question number two. During a well child visit, the mother of a 15-month-old boy expresses concern that her son is not speaking in sentences. Which developmental milestone is most appropriate for a 15-month-old? Is it A, speaks in full sentences? Is it B, uses 2 to 3 words besides mama and dada? Is it C, copies a circle? Or is it D, knows colors and shapes? Take a moment and tell me what you got in the comments, y'all. All right, stem of the question here. Which developmental milestone is most appropriate for a 15-month-old? All right, so let's see what's going on. We have a well child visit, and the mother of this 15-month-old boy is concerned because he's not speaking in full sentences. So what is the normal range for this 15-month-old? And the best answer is B. They use 2 to 3 words. At 15 months, the child should be able to say a few words. Um, they don't typically say full sentences until about that preschool age. 15 months, you can expect a few words and walking independently. All right, and lastly, question number 3. A 68-year-old man with a 50-pack year smoking history presents for COPD follow-up. His FEV1 is 38% of predicted, and he has had 3 exacerbations in the past year requiring oral steroids. He currently uses albuterol as needed and a LAMA. According to GOLD guidelines, what is the most appropriate next pharmacologic treatment? Is it A, add an ICS? Is it B, continue current regimen, no changes needed? Is it C, prescribe oral theophylline daily? Or is it D, start a long-term oral corticosteroid therapy? Take a moment and tell me what you got in the comments, y'all. All right, and so stem of the question here. According to GOLD guidelines, what is the most appropriate next pharmacologic treatment? So let's see what we're dealing with. If we're talking treatment, we got to look and see if they're giving us a diagnosis. This patient has COPD. And the FEV1 is 38%. So first, you want to start here and determine what stage COPD, because we know the diagnosis is COPD, and we're trying to see our next step of management for it. But you have to understand what stage they're in to even be able to consider that, right? And I'm still teaching you based on the guidelines that they're currently testing you on. So with FEV1 of 38%, that's a stage 3, right? Stage 3 of COPD, right? Because in this stage, it's anywhere from 50 to 30%, or you can say 30 to 50, whichever. I hear people say their brain sees it better the opposite way. So whichever works for you, but that 50 to 30 range is stage 3, right? So that falls there. So what do we do in stage 3? And it specifically says pharmacologic treatment. So what medicines do we do in stage 3? So we know we do a short acting, which they're already on. They're on the albuterol. We know we do a long acting, which they're on. They're on a LAMA. So the next medicine is an ICS, right? Remember, I tell you, Brittany's brilliant. Stage 3. Remember, ICS is 3 letters, and we started in stage 3. So A is your best answer. All right, y'all. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call. You can shoot a text message to this number or shoot us an email. And as always, everything that I offer is linked in the bio of this channel, including my website. And as I mentioned previously, my website is also linked in the description of this video. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.